So today we'll be talking all about what is the human metapneumovirus, or what everybody is calling HMPV. So this is a virus that usually causes symptoms similar to the common cold. It often causes upper respiratory infection, but it can sometimes cause lower respiratory infection like pneumonia, asthma flare-ups, or even chronic obstructive pulmonary diseases, or what we call COPD. It can make this condition worse. It's more common in the winter period as well as in the early spring. Most people who get HMPV are before they turn 5, so like children. But it's important to note that you can get HMPV again, but the symptoms are usually mild after your first infection. A lot of persons would ask, is it just a cold? Even though it causes symptoms like just a cold, it can make some people very sick. You're more than likely to get severely sick if it's your first time catching it, or if you have a weak immune system like the elderly people or persons with other comorbidities like hypertension, diabetes, other respiratory tract infections, or respiratory diseases like asthma. They are more prone to get this severe form of this virus. Another question that people ask is it the same thing as the RSV? Well, it's not the same, but it's very similar. It's part of the same genus of viruses, and as I said before, the symptoms may be the same. So what symptoms do you expect to have if you are suspected of having it? You can have a cough, a fever, a runny or stuffy nose, sore throat, wheezing, shortness of breath, or even a rash. So what causes it? Well, a virus, a little small germ that uses your cell to make more copies of itself. How do you get it from one person to next? It's transmitted through direct contact with somebody who has it, or from touching things contaminated with the virus. For example, through coughing and sneezing, shaking hands, hugging, kissing, touching surfaces or objects like phones, door handles, keyboards, or toys where the affected person has touched before. And the risk factor for getting it, or who gets it, is that anyone can get it, but you're at a higher risk if you're a child younger than 5 years old, or you're an elderly person greater than 65, if you have a weak immune system, like from conditions like HIV, cancers, other autoimmune immune diseases, or even medication that suppress your immune system, like if you're on some corticosteroids, or if you have asthma or COPD, you're more prone to get it. So sometimes this virus causes complication, and these complications might be very serious and require you to be hospitalized. So you can get a bronchiolitis if you're a child, you can get bronchitis, pneumonia, asthma and COPD flare-ups, you can even get an ear infection, or what we call otitis media, and we diagnose it in the hospital based on your clinical history. You can also get a swab of your nose and your throat and lab tests to further confirm same. It's important to note that you probably won't get tested for it unless you have very severe symptoms. Some persons may opt to do a bronchoscopy or even a chest x-ray to look for any changes in the lining of your lungs. As regards to treatment of this virus, there aren't any antiviral medication to treat HMPV. However, most persons just manage their symptoms to feel better. And if your oxygen level is low, you can get oxygen therapy if you're having a hard time breathing. If you are dehydrated, you can get IV fluids directly into your veins to keep you hydrated, and you can even get some corticosteroids to reduce any inflammation and ease some of your symptoms. And a very important question that's always asked is that, do you need antibiotic for this? The answer is no. Antibiotics only treat bacteria, and the HMPV is a virus. So an antibiotic will do nothing to this virus. So it's important to wash your hands often with soap and water, cover your nose and mouth, or so if you're sneezing or having a cough, wear a mask, avoid being around people who are sick or with contagious illnesses, avoid touching your face, your eyes, and your nose, and do not share eating utensils like forks, spoons, or with others. It's important to note that mild cases of this HMPV virus usually last a few days to a week, but if you're very sick, it might last longer. It's important to seek medical attention immediately if you have a high fever over 103 degrees Fahrenheit or greater than 40 degrees Celsius at home, if you have any difficulty breathing, or if you have any bluish skin on your lips or your nails, is what we call cyanosis, or if you have any worsening of any other health issues. So if you have the mild disease, what you can do is just drink a lot of fluid to prevent dehydration, or take over-the-counter medication like any pain relievers, decongestants, or cough suppressants to help with your symptoms if you're having a cough or a cold. And do not give medication to your kids without consulting your pediatrician or your doctors first.